Well, the federal government has released a draft strategy it hopes will improve the lives of Australians living with autism. The strategy aims to find ways to improve outcomes for autistic people across all stages of life. 4 key areas were identified early in the consultation process. They include social inclusion, economic inclusion, diagnosis, services and support, as well as health and mental health. The prospect of a national autism strategy comes amid a surge in the numbers of Australians with an autism diagnosis in recent years. It's thought that at least 200,000 Australians are on the autism spectrum, though the true number is likely to be much higher. Now, that could be attributed to several factors, including the time and cost of getting a diagnosis. About 95% of people with autism also have other disabilities or neurodivergent diagnoses. Well, with more, I'm joined by Nicole Rogerson, CEO of Autism Awareness Australia. Good morning, Nicole. Thank you very much for joining us.
Thanks for having me.
I know you've been able to cast your eyes over this draft strategy. What is your take on it?
Oh, look, first, relief. It's great. We finally have a national autism strategy, or a draft of one. That's a great first step. Certainly a lot of us have been calling for one for years. But then there's the other side of it, which is actually a bit depressing, is that, you know, it's 52 pages of all of the areas we still have to address, and it feels like, have we got anywhere in the last 20 years? So, you know, it's a comprehensive list of what we need to do, but it's just that. It's a list of areas we've identified. Now we have to actually get on and do the work.
Are you suggesting that the list is almost too much to deal with in one strategy, or...?
Look, a national strategy on autism is a little bit like a national strategy on being human. You know, there are so many parts to it, and there is not one type of autism. There are many types of autism. As you know, it is a very broad spectrum, and it gets broader every year. So to be able to say that it's just easy, that we just have to have one strategy that's going to sort people with autism out, some strategies will work for some people with autism, some will work for others, but there's no one catch-all here. This is a huge amount of work to be done.
Is that part of the challenges with this draft strategy, in that it focuses on one cohort? Because we know that those who live with autism experience very different lives.
Yeah, and it's important to understand I'm not an autistic person. I'm the parent of an autistic person, and I run an organisation that is very much advocates for parents and families. So we would see the needs of children, and particularly those with possibly more profound autism, to be quite different than those sort of more neurodivergent voices in the community who are people who typically had their diagnosis later in life as adults. So we've just got to remember there's lots of different people on the autism spectrum, and it's complicated and it's difficult, but that's okay. We can do hard things.
I guess, though, without a national strategy, where does that leave you? So I would imagine you're welcoming the idea of a national strategy.
Yes.
Where should it start then? What are the parts in there that you think are really great steps towards enriching those lives of people who live with autism?
I think the strategy has done a great job of recognising all of the areas that people with autism find life difficult, and it's done a very good job of calling out the need for state and federal governments to work together, because not all of these systems live in one place. You know, with the NDIS is federal, education systems are state. You know, oftentimes autism and autism families just get lost in that mix. We don't get more coverage, we get less. So I guess those things are good, but I'm old enough and cynical enough to just say state and federal governments have been terrible at working together over the years on this one. So will this strategy be the thing that's the kick in the head to them all to say, come on, we've got to do better? I hope so.
How do we fare when you look at our global counterparts with national strategies, say, in countries in Europe or in the United States?
Yeah, look, certainly the United States and the UK do a lot better job than we do, but in saying that, neither of those countries have a national disability insurance scheme. So we're ahead in some places, we're behind on others. But I think in all of the conversation today, because it is World Autism Awareness Day, so autism will be discussed. This is a great first step for Australia. Strategy is a great thing to have. I'm just going to be the cranky old lady that says, what are we going to do with it? Because, you know, my son is 28 now. We are still looking at some of the challenges that existed when he was small are still there today.
What are some of those challenges?
Oh, it's everything. Today, Autism Awareness Australia has released a report about parents' experiences with their children in the school system. You know, 35% of Australian families are still being discouraged for having their child enrol in the local school. You know, 50% of those schools were in the public public system. Unemployment rates are incredibly high for autistic individuals. So there's a lot of work to do about awareness, and we have done well with that. And the Australian people are typically more aware of autism, but we shouldn't let that awareness and that celebration of autism, which is really important, and we have to do it, we then have to turn around and understand the challenges are still there, and we haven't fixed many lives. And for a lot of people with autism, they won't go on to live independent lives, and that has a flow-on effect to them, their families, their siblings, and the whole community. So we can't leave those people behind.
We know that one of the key areas that have been identified in this report is the health and mental health of those living with autism. Can you remind our audience or explain to those just how their health and mental health might be different to those who aren't neurodivergent?
It's often really difficult, and the mental health issues go side by side, particularly as autistic children age. They may have very difficult time at school because it's sometimes quite hard to be a square peg in a round hole. Unemployment, social experiences, social inclusion. We know the rates of suicide in those with autism is much higher than the general population. So that just is another thing to overlay on top of everything else we have to take care of. And it's also very hurtful for a lot of people in the autism community to see the headlines that are always inevitably about the NDIS cost blowout, and it's inevitably lies at the feet of those with autism, where it's actually a lot more complex than that, a lot more nuanced. But of course, you know, it's a very complex situation, and it's great to have this discussion today, but I really encourage people to look at the strategy and understand the list of areas that we still need to improve on, because we've got a really long way to go.
Well,